After your neurosurgeon has decompressed the spinal cord and the nerve root, there are two options. They are either a fusion or a disc replacement. A fusion means that the bones are going to grow together. And traditionally, the way that would occur is a surgeon would take bone out of your hip and put that bone where the disc used to be, between the vertebral bodies. Eventually, over time, that bone would grow together. It's very high quality bone because it's yours. However, it's very painful where the hip graft was taken, and really for the rest of your life you'll complain of hip pain. So consequently, a number of years ago, we stopped taking bone out of the hip and started to use cadaver bone. The advantages of using cadaver bone really is to save you an incision over your hip and the hip pain. There are negatives, however, and those include a small risk of AIDS and hepatitis. And also the bone from a cadaver isn't quite as strong as your own hip bone. Consequently, a number of years ago, we stopped using cadaver bone also, and we went to a man-made type product. To you, it looks as if it's plastic, and it's very small. This is called a PEEK intervertebral device. It is man-made, there's no risk of AIDS or hepatitis, and I don't have to take bone out of your hip. Instead, I just use the bone that I remove around your disc space, fill the middle of this with your bone, and I insert that into the disc. This will be custom crafted and sized at the time of surgery so it fits you perfectly. That saves you the hip incision, it saves you the risk of AIDS or hepatitis, and it works very, very well. Next, after the spinal cord and nerve root have been decompressed and we've placed this PEEK intervertebral device into the disc space, we move towards the formal fusion. That's placement of a plate and some screws. The plate holds the bones together, and the screws go into the vertebral body about 1.5 centimeters. This plate system won't provide permanent stability, but it's much better than the old system. It will hold you together until the bones grow together. Once the PEEK intervertebral device has been placed into the disc space, all we have left is the fusion aspect. This plate and screws provide instant stability and greatly increase your fusion rate. It's nothing but good for you to have this placed in there, and it diminishes your postoperative pain.